Hey, what's up guys? My name is John and I'm an emergency medicine PA, and in today's video I'm going to be talking about the best healthcare experiences, patient care experiences that you can get for PA school. And then at the end of the video, I'm going to share with you guys what I did for my patient care experience and how many hours of healthcare experience I had before I entered into a PA program. And the reason this video is so important is because healthcare experience just after grades is probably the second most important factor in your PA school application. It's a very easy way for these PA programs to weed out candidates. If I remember correctly, the average PA school applicant has 1,600 hours of patient care experience, which translates to about 1 full year of working full-time. And some schools put more emphasis on the healthcare experience and patient care experience than others, because some will only want you to have maybe 300, 500 hours of patient care experience, while others will want you to have 1,000 or possibly even 2,000 hours of patient care experience. If you have about 1,000 hours of patient care experience, you should be good to go for most PA programs. PA schools require healthcare experience so that you can understand our healthcare system better, so that you can develop a good bedside manner and grow as an individual. A former program director for my PA school once said, "We can teach you the medicine, but we cannot teach you how to be a good human being, how to be a polite, caring, empathetic, and ethical healthcare provider." Guys, before we get started with this list, if you could please just take a quick millisecond and hit that like button down below. Really helps the channel out so much, really helps us get seen by more people on YouTube. And also thank you so much to my VIP patrons on Patreon for directly supporting this YouTube channel and making this video possible. Here's just a general overview of patient care experiences and healthcare experiences for PA school. I'm going to run through the best ones and good ones for getting into school. My criteria for the best healthcare experiences for PA school will provide a reliable way to gain patient care experience for most PA programs, as they are widely accepted as experience. They provide decent pay, and they have low entry requirements. The first is the EMTB. EMTs are healthcare workers who staff ambulances and provide basic life support or BLS care to their community. EMTs receive training on common pre-hospital conditions, airway management, taking vitals, CPR and AED use, administration of some medications, how to safely transport patients, and EMS systems overall as a whole. There are numerous advantages to being an EMT for the purpose of getting into PA school. You will have a good amount of autonomy as an EMT in BLS care on the scene and in the back of an ambulance. However, it's not free reign, as you are bound to state protocols and physician-directed medical command. Being an EMT for PA school is great because you can hone your patient interviewing skills, your patient reports, medical documentation. You work with a partner and you will have to use a lot of critical thinking on the job, and there are many practical skills that you could develop. There are numerous companies nationwide and local companies who need EMTs. You can run 911 calls or go for interfacility transports and lower acuity care. Overtime hours and additional compensation do exist. However, I've seen EMTs earning anywhere from $10 to $16 an hour for more rural locations, while higher cost of living areas might have EMTs making more like $16 to $21 an hour or slightly more. The downfalls of being an EMT is unfortunately some places do not have paid opportunities or are looking for volunteer positions. The onboarding process can be quite long and tedious for new EMTs. There's just so much that you have to learn and get used to and accustomed to when you're first starting out. So there's going to be a couple months where you're kind of having to learn the ropes of everything. To become an EMT, you'll need to get a certification from the state and possibly even pass the national EMT exam. Once you're certified, usually your state certification is good for a few years, and you will need periodic renewal through CMEs. But you also get the opportunity to do things like specialized EMS training in addition to things like hazmat training. I remember I did a course on hazmat EMS. A whole bunch of extra courses and certifications and learning opportunities for you as an EMT. The next healthcare experience I want to talk about is being a CNA, or a certified nursing assistant. And I know a lot of PAs who actually gained entry into their PA programs by being a CNA. A CNA works under supervision of an LPN or an RN. The requirements to becoming a CNA definitely vary by state. However, most states want you to be certified before practicing, which may require a course costing anywhere from $1,000 to a couple $1,000, give or take. Once you're a CNA, your pay will range from about $10 to $14 an hour, with more experienced CNAs earning $18 to $20 an hour. The problem about being a CNA is that some CNAs get to do vitals and have a lot of time interacting with patients and doing tasks like cleaning patients. Meanwhile, other CNAs have very little patient care and are placed more into administrative positions. If you are going the CNA route, Make sure that you are in a job role where you do get that direct patient care experience, just to leave no doubt for these PA programs that you earned all of your hours. ER techs. I think being an ER tech is a great experience for PA school. ER techs work in emergency departments and do everything from performing CPR during cardiac arrest to drawing labs, gathering supplies, moving patients around the hospital. You'll learn how to use the hospital's electronic medical records, proper safety and cleaning protocols, how to obtain an EKG, how to use the cardiac monitor, how to perform IV insertions, how to apply splints and teach people about crutches, helping patients with hygiene tasks, recording vitals, and doing other skills and tasks that the ER staff require. As an ER tech, you'll have the opportunity of learning alongside nurses, PAs, nurse practitioners, and even physicians. Some places will want you to have your EMTB or a CNA certification before you become an ER tech, while other places have no such requirement. They just want you to have CPR and AED skills under your belt. ER techs are earning anywhere from $15 to $30 an hour. However, I'm sure there's once again going to be variation on that depending on where you live. The next healthcare experience I would like to talk to you guys about are paramedics. Paramedics are ALS providers who work on ambulances or in the pre-hospital setting. The role requires more skills, knowledge, and responsibility than the EMTBs, which I spoke about before. The pay is also better, with paramedics making about $16 and $24 an hour, and more seasoned or supervisory paramedics earning over $30 an hour, while fire-based EMS tends to have better compensation, especially if you are salaried. And here's the thing, if you are already a paramedic and you're gaining experience for PA school, then great. If you're an EMTB and you're thinking, should I go to paramedic school to better prepare myself for PA school? While you will definitely learn way more as a paramedic, I don't think you necessarily need to go become a paramedic to get into PA school. Your EMTB hours would be enough for PA programs without having to go through the extra time, money, and effort to become a paramedic. The amount of time required to be a paramedic definitely varies. I've seen paramedic education spanning from anywhere from 6 months to 2 years. Paramedic training consists of about 45 credits, medical management, trauma management, OBGYN, and psychiatric care, and the administration of a wide variety of medications. As a paramedic, you still have to adhere to your state EMS protocols and physician-led care. However, you do get a huge amount of autonomy while in the back of the ambulance, and you make even higher decisions and even more critical decisions than EMTs in most cases, because you will be responding to more of these ALS calls. Registered nurses. Being a registered nurse can be a good way to gain healthcare experience for PA school. I personally know of a few nurses who went to PA school rather than going to become a nurse practitioner, purely because they thought it was a better opportunity for them and a more rigorous education than some nurse practitioner programs. The main problem about going to nursing school for the purpose of becoming a PA is that a 4-year degree has become an almost universal requirement to become a registered nurse, and you need to pass the NCLEX. These avenues are a prohibitive way to gain PCE if you're starting from scratch when compared to the entry requirements of a CNA or an EMT. However, if you are already a nurse, then being a nurse obviously is very good patient care experience for entry into PA school. Registered nurses work in a whole variety of healthcare settings. Registered nurses earn anywhere from $60,000 to $80,000 a year, and there are registered nurses that are making more money than PAs. I mean, I've heard of registered nurses in California pulling $160,000 a year. You could make a lot of money as a registered nurse. You might become a nurse and not even want to go to PA school after you enjoy it so much. One of the other advantages is if you go the nursing route, you are getting yourself into a very great profession overall. So even if you don't get into PA school, or you decide at a later point in time you don't want to go to PA school, you still have a pretty good career ahead of you regardless. The next healthcare experience that I want to talk to you guys about is being a medical assistant. MAs are usually people who help speed up patient care in a doctor's office or a clinic. Medical assistants could administer vaccines, draw blood, do routine labs, or even swabs. They might also be tasked with simple procedures such as obtaining an EKG or helping flush out a patient's ear. They record vitals, they place the patient in the room, they ask the patient a few questions about their concern for the day, and relay that information to a medical provider or doctor. The barrier of entry to become an MA is pretty low, and you can obtain a ton of patient care experience through this role. And then lastly, for my best patient care experience list is other nursing roles. Whether you are an LPN or an LPN requires 2 years of training and usually is paid somewhere between $30 to $50K a year. And a quick description is that LPNs help the nurse or physician by taking vitals, assisting with personal hygiene, feeding patients, placing catheters, administering medications, and also assisting with other procedures or paperwork. LPNs also work and supervise CNAs at times, depending on where you're at. So an LPN or an LVN, licensed vocational nurse, usually somewhere in between like a CNA and an RN. You do have a mix in tasks of the RN, however, you're not a registered nurse. Next, I'm going to talk to you guys about some good ways to gain patient care experience. The first good way I'm going to talk about is a medical scribe. If you ask people who are scribes in an emergency department what their future plans are, usually most of them want to go into medical school or PA school. You know, they have aspirations outside of just being a scribe. It's usually a job for younger individuals who just want to be exposed to the healthcare setting. And as a scribe, your job is to chart the physician's patient encounters in real time and help with documentation. It speeds up documentation for the provider and allows them to spend more time on patient care. Scribe compensation starts from minimum wage to $13 an hour, range up to $15 to $20 an hour. However, you have to be careful with scribing because some PA schools do not consider scribing as patient care experience. They will consider it healthcare experience. Also, each scribing job varies a lot. Some jobs, they have the scribes come into the room with you to help document, and you get to see stuff that way. Other times, they don't want you in the rooms. You kind of just stay at a desk and you scribe whatever the physician's telling you. And if that's the case, you're missing out on experience. So it's not really equivalent depending on which scribing role or job you take. If you're going to be a scribe, look into which PA programs will accept scribing as a healthcare experience, and also make sure that the job that you're taking has you directly exposed to patients rather than just sitting at a desk being a physician's typewriter. Other allied health jobs like x-ray techs, surgical techs, physical therapy techs, aides, ophthalmology techs, pharmacy techs, home health aides, midwives, respiratory therapists, behavioral health counselors, the list goes on and on and on. All of these people interact directly with patients. However, the amount of educational requirements beforehand do vary significantly, so you guys have to look that type of stuff up. The good thing is that most of these jobs are paid. Some pay better than others. Foreign physicians. If you are a physician from a foreign country and you would like to come to the United States and practice as a physician assistant, well, obviously your time as a physician abroad will be counted towards PA schools. During my PA program, I believe we did have one foreign physician from India, and she successfully completed the PA program and is now a practicing PA in the United States. Exercise science professionals. This list includes physical therapists, athletic trainers, exercise physiologists, and kinesiotherapists. Requirement to gain entry into this field of practice vary. However, you will likely need a bachelor's degree. Some physical therapists are now earning, masters and doctorates, so there is a lot of educational requirements to be a physical therapist. If you are one and you're working as one and you want to go the PA route, there is a place for you if you're interested in exercise science to become a PA and to be a great PA. Registered dietitian. I know of dietitians who gain successful entry into PA school using their dietitian experience. A registered dietitian is someone who completes a bachelor's degree and then follows a 10 or 11 month internship. Once their dietitian studies are complete, they can sit for an exam. Passing this exam earns you the title of registered dietitian. Dietitians work in healthcare settings like the hospital, ICU, nursing homes, where they may even be self-employed. They create personalized or institutionalized meal plans. They also monitor patients' nutritional goals and create plans for those with allergies. Phlebotomists are those who go and draw blood for a living. You should verify with your PA school that they still accept phlebotomy or phlebotomists as direct patient care experience. Dental assistants or hygienists require a 2 to 4 year degree, and then you'll have the ability to work in a dental or orthodontic office. They clean teeth, assess for disease, and provide preventative oral care and information to patients. And dental assistants work in dental offices under the supervision of a dentist or dental hygienist. You may need to pass a certification exam depending on what state you're in, and the pay for a full-time dental assistant, for instance, is $30,000 to $40,000. Pay for a dental hygienist is as follows. So guys, that was a big list. It is not exhaustive. Obviously, there are a vast variety of ways that you can gain patient care experience. But those are a few ways that people who have already gone through PA school, that's what they've done to get there. Now, to quickly talk to you guys about my healthcare experience, because I'm looking, I got to go to work soon. I was an EMTB. I was an emergency medical technician on an ambulance for my patient care experience. I did a course while I was in university up at Penn State, and I volunteered on a local ambulance for about 300 hours. After I graduated, I wound up being a part-time EMTB, and I loved it. I definitely want to get back in on the ambulance. However, I realized that, being an EMT was not going to be my full-time career or profession. And I talk about a few of those reasons why in my video about why I quit EMS. If you guys want to check out that oldie, it's one of the first videos on my channel. I was an EMT for about 7 years in total. I had just over 1,600 hours of patient care experience once I matriculated into PA school. If you guys enjoy content like this, please consider subscribing. The vast majority of people who watch my channel are not subscribed. And if you've gotten this far in the video, clearly you're enjoying this video and content like this. So please, what are you guys waiting for? Hit that subscribe button. Also, don't forget to hit that like button down below. It really helps the channel out so much. Really helps us get seen by more people on YouTube. You guys could check me out on Instagram. I share a lot of stories on the life of a physician assistant. If you guys are already obtaining patient care experience, tell me down below what you're doing and how much money you're making, and if you recommend it as a patient care experience for pre-PA students. And as always, guys, stay safe out there. Have a great rest of your day. Bye-bye.